They're usually coming to me because they already know that they have a problem. They can see it in their vision. Their visual quality's gone down. They're having more problems driving, things like that. There's two reasons why people don't want to do surgery, but the vast majority are just nervous and scared. They're usually coming to me because they already know that they have a problem. They can see it in their vision. Their visual quality's gone down. They're having more problems driving, things like that. One is that they're scared of cost. Two is that they're just scared of the actual procedure. I usually try to address those two things with them because that's usually would be the reasons why they don't do it. Fear of the surgery is a real thing. For me, having done tens of thousands of surgeries, I know it's going to go really well. For them, it's their first experience and it's their eyes, which are precious to everybody. And of course, we understand that. Cataract surgery overall is extremely safe, especially in the hands of experienced surgeons. We do thousands per year. There would just literally be no way we could do that volume if we were running into problems consistently. It's extremely rare to have a problem with cataract surgery. The vast majority of patients are very satisfied, high patient satisfaction, very low complication rates. It's the safest surgeries you can have, and the results are almost immediate. And people very quickly after they have their first surgery and they realize they just get over that initial fear, they move on to their second eye. Usually they just can't wait to get the second one done because they sort of understand what's going on at that point. But it's a completely natural thing. We definitely address that. I usually let them know that we're going to give you some sedation during your procedure. We're going to make you comfortable. I also just like to chit chat with them, just establish a little rapport. One thing they're a little bit surprised to hear is that I'm going to be awake during surgery, and that freaks them out. And we say, yeah, but you're not going to see me coming at you with like my instruments. It's not going to be scary. You're not going to be gripping the rails. It's just going to look like a little kaleidoscope light show, and we'll have a little conversation, or sometimes we just listen to some music, and it's over in about 10 minutes. So the whole thing is about 10 minutes. We don't use any stitches, needles. It's a comfortable procedure. It's no pain involved. From the time we actually start the procedure, it takes about 7 to 12 minutes on an uncomplicated scenario, which is the vast majority. Usually by the time people are just settling in, I often hear when you take off the drape, they're like, that's it? We're finished? I thought we hadn't started yet. It's a really quick, very fast procedure, 7 to 12 minutes. Cataract surgery is a once per eye per lifetime. And once you remove a cataract, it never comes back. That's the big advantage. That actually is sometimes a big relief to people, especially my younger people who just happen to develop cataract. They feel like, oh no, I'm too young for this and I'm going to probably need it again as I get older, but I always let them know it's not the case. Actually, for some people, it's a big benefit because when we do your cataract surgery, we can refocus your eyes to be more in focus without glasses. That's a real advantage for people, and once they hear that, they get more excited about it.